Consumer's Doctor, welcome to the Consumer's Doctor's channel. This is all about health insurance, personalized. So that's my main focus. How do you personalize the health insurance? Again, thank you for joining again, and I'll be streaming every day on a regular basis, Monday through Friday. And if you keep I'm still working on these chats and interacting with you guys, and this is all a learning lesson for me. So you just be patient. I'll One of these days I should be able to interact and address all your concerns, and that's my main focus. Is I'm eagerly looking forward to interacting with you guys. This is my goal so I can address. I'm sure there are a lot of questions out there about the how do you personalize the health insurance? Well, there is a way, and irrespective of whatever happens in Washington D.C., I think you guys need to focus on yourself and on your own future, your own independence. We want a total freedom in healthcare, total freedom. We don't want anybody to telling us where to go, what to do, and all that stuff. You need to be in the driver's seat. That's what my goal is. How do you do that? Generally, healthcare is when you receive the care from the doctors and hospitals, and how you pay for it, how you finance it. That's what the insurance, health insurance, is all about. After you're done with your care, you need to pay for it. How do you finance that care? That's what the bottom line is. And there is a way to do it, folks. It's and if you set it up in the right way, you could be in the driver's and you could be financially independent on the long run. So insurance is based on a concept of risk pooling, where we pool the entire population, and you pool it and you share that risk. Basically, a large group with similar risk. But what does similar risk means? That's what it's about. It's about grouping people by their health status, such as different categories. You have a right to be grouped with others who have similar health risk. That is your right, to be grouped with similar risks. Only then you will be able to get relevant and timely information, appropriate level of coverage, and proper medical care. Proper medical care at affordable premium. That's what it's all about. You have a right to be grouped with a similar risk. That's our right. But right now it's not happening. It is not happening. This is what I've been trying to tell you guys. This is not happening. You're being grouped irrespective of the risk out there, the entire population. You're being exposed to that risk. You're paying for. Your premiums are based on the entire population with different risks. That's why. And you're also paying for people who are out there, 28 million Americans who have no insurance. And you're paying for it. How about that? You are paying for people who are uninsured. If person goes to the hospital does the uncompensated care, and hospital takes the burden, and that burden is carried on to the people who are folks like you who are responsible, who take care of yourself, you pay the bills, you do. And so hospitals have no other choice. Put that same bill on folks like you. That's why the hospital costs are high, in addition to the regulations. Why is the hospital cost high? That's what it is. And most of these hospitals are not doing well. They're not viable because they're providing care for illegal Americans, people with no insurance, people people with different risks, and invariably, and hospitals are not transparent. What they do is they lump them together, they bill your insurance. So your premiums are not based on you, your premiums are based on everybody else's problems. This is this is this is the way our healthcare is so dysfunctional. I just can't imagine. We are all bearing the burden for people who are uninsured, illegal Americans. We are paying for everybody else. And Affordable Care Act is adding burden to it. What Affordable Care Act is doing is people like you, average folks who are responsible, we can't get the right premium because premiums keeps going up because of the Affordable Care Act. Unless you cannot put everybody into one box and say, oh, okay, this is your premium. You can't do that. Your risk needs to be segmented. Your premiums have to be segmented basing on individual person. This is what I've been talking about. I don't want to get into the semantics of, oh, the left and right and this and that. I don't want to get into that. This is not my job. I am your consumer's doctor. I'm focusing on you. I need to tell you the facts. At my heart, I'm a Democrat. But over the years, I've seen the changes happening. I don't know what's going on with Democrats. I have no idea what they are trying to do. If they sincerely want to help people, really, focus on them. Why do you punish people who are average folks like you and me? And focus on the people, on them. Don't pull everybody into this Medicare for all, universal care. Come on, guys. You can't do that. We have come this far on the healthcare and we are spending so much money. We're wasting so. Why can't we? We are wasting almost $3.8 trillion, folks, in 2019, it is almost like 17.8% of the GDP, year after year, year after year. And that money disappears. We don't know where it goes. That $3.8 trillion invest in us. Give us the power to take care of ourselves. That's what I've been trying to. This is what I'm passionate about. Give that money back to the Americans. That money belongs to us, I'm talking about including employer subsidized, government subsidized, veterans. All that money is being pumped into the intermediary organizations. Why can't you trust the Americans? Give that responsibility to the Americans. They can handle themselves. If Medicare is paying my $1,200 to intermediary organizations, why can't Center for Medicare, CMS, Center for Medicare, if you're listening, If you are paying that $1,200 to the intermediary organizations, whoever they are, I don't care who they are, and you're giving the full risk contracts to these people, what very first thing what they're doing is curtailing the services. They restrict the care. They restrict the services, co-pays, deductibles, denials, pre-existing illness. They don't cover so much stuff. And you're bombarded. I know it's easy. People don't think in a right way, because when they say, oh, I don't have to pay anything, I'll just sign, I give my life away. That's easy. You just give my life away. But you guys don't realize, by signing your Medicare off to the intermediaries, they don't know you're not getting the right care what you need. When you are signing off your Medicare coverage, your $1,200, giving it to the intermediaries, what they are doing is they take your $1,200, they provide you for $500. What I'm saying is, give me that money. CMS, Medicare, give me that. I will take care of myself. If if the Medicare gives me $1,200, very first thing I would do is, first I will evaluate my own health status. How often I go to see how much expenditure there is. What I would do is, I will get an insurance. Insurance has to be based on the risk segmentation, folks. Right now, the insurance is risk pool you're sharing with. The risk segmentation is the way to go. We all fit into the well category. Okay, there are four categories. Four categories. Well category. There are no claims, low risk, good nutrition, active lifestyle. We belong to the most of them belong to the well category. Almost, I would say, it's almost 62% of the Americans belongs to the well category. If you really look at the claims from these folks, there are zero claims from the well category, but if you're looking by the population, it's 15% of the entire population. And if you look at in the well category, the claims are only 12%. 12% of the total population. That is, your premiums have to be based on that. They're healthy. They have no claims. They don't see the doctor. They have good nutrition. They maintain their health. Why is our Medicare monies putting that money into the intermediaries? I don't get it. They should give that option to the Americans, where they can choose, mandate. Everybody should have health disclosure, healthy premium, HDHP. Everybody should have HDHP. Health is no longer deductible. I understand, the high deductible, this. I just renamed it as health disclosure, healthy premium. Your premium is based on your health. So if I go and get a premium, which is for regular folks out there, HDHP premium is $156. At my age, it should be around 500, whatever, 500. Whatever. The difference of 700, I can put it into my personal account. Personal saving is called Health Solutions Advantage. It's called HSA. And your funds are in the HSA. Nobody can touch it. That is yours. And it is locked in, and you get, if it's in the Fidelity HSA account, it is tied to the mutual funds, or it is tied to the ETFs. You don't need to buy individual. You cannot take risk on that account. You need to put it in a non-risky funds, like mutual funds or ETFs, you know, tied to the S&P index, NASDAQ index. You cannot go wrong with that money, folks. It grows average 5-10%, and it's not taxable. That's the beauty. Contributions are not taxable. Whatever the you're accumulating is not taxable, and withdrawals are not taxable. That's the beauty of HSA, Health Solutions Advantage, folks. Everybody, I think government has to pass a law. Everybody, every individual has to have Health Solutions Advantage accounts. That's where you keep aside whatever your savings are. I would like to see people in the lower income category, at least you're giving them the tool of savings tool for them. In addition to the insurance, government has to give 100,000 insurance for 15% of the population who are low in cat. I think if Democrats you're listening, give them the insurance what they need, life insurance. People are in the low income bracket, they can't afford it, they can't make the payment. How much does it cost to get 100,000 insurance for a lower income cat? How much does it really cost? Tell me. You see the ads like 18, 20. If life insurance is inexpensive, folks, government can, Democrats, if you're really listening, can you focus on, if you really want to help the poor, get them life insurance. Pay for it. Government can do that. That's where I want the Democrats to help. And that will help them, give them the confidence that at least they can take care of their family if something happens to them. That's the least government can do. As Ronald Reagan said, half the time government is a problem. We need to find solution. Government has a responsibility to take care of the people, man. That's the least they can do. Buy the insurance, life insurance for 15% of the poor people. Can't they do that? They're wasting so much money. As Indian Prime Minister has done, he has given life insurance to the poorest of the poor, 100,000 rupees for entire I don't know. You're talking about millions and millions of people. 40 to 50 million people have life insurance because of Prime Minister Modi. He has given a guaranteed life insurance because folks are in the lower income, people are really poor, they don't have any possessions. If something happens to them, their family suffers. The least government can do is help them to get a life insurance. That's a different topic. Coming back to, I get cat. I want to help the poor man. I really want to help the poor. But we need to give the right tools to the poor people. You mandate, universal socialize everything. You mandate it, just not going to work. Don't give them a free handouts. Give them the tools what they need. They're not begging you for money, guys. They're not begging you for money. They're asking you to provide the right tools. I'm addressing to the fellow Democrats. Now, President Biden is going to be leading the country. I'm begging the Democrats, give them the tool. They don't need the handouts. You guys want to give the handouts. There's no money to give a handout. We already had so many $25 trillion in debt. Where are you going to print more money? Come on, guys. We need to stop that bullshit. We need to give them the tools what they need. Again, let the politics go. Every time it hurts me when I listen, when I see what's going on in this country. I think India is doing a better job of taking care of the poor. America is failing, man. America is failing. They're not taking care of the poor people. I see on the streets with the shopping carts. It's so sad. I see them. You're talking about San Francisco. Los Angeles, if you go onto the streets, people with the carts and their possessions, that's their possession. Shopping cart, those clothes are their possession, man. And these people, they just say, oh, they don't take care of the poor people. They don't take care of the people who really need help. People are asking for coverage, health coverage. How do you do it? Don't give them the handouts. Don't mandate it. Give them the tools what they need. What they're asking is give them the coverage for it. If people are cannot provide, they cannot afford the health insurance, give them the certificate of need. They can go and choose what they want. That's what they are looking for. Certificate of guaranteed certificate of coverage, not by the government. Public private partnership. This is what I want to see. Public private partnership. When you create a public private partnership, there is a health review authority. They determine who are in the lower socioeconomic status. They should have the coverage. Give them the certificate of guaranteed coverage. They will, and I can bet you, insurance companies will love to provide the coverage. Once you give that certificate of need coverage, insurance companies will give you the coverage. You don't. Government doesn't have to get involved. They can fund it the way they want it, but as long as you have the coverage, they will go and get the and give them the tools how they can save money. If you give them the coverage and whatever it is they have extra income, they can put aside so they can step up the ladder. Again, it hurts me when I see people talk about, you know on this, when I see people with their shopping cart. It's just literally, I come from a poor country, man. I come from a poor country, and America has so much resources. They're wasting all the resources. They don't even take care of their own Medicare population. Medicare people are suffering, just by throwing $1,000 at them. A lot of people out there, they can't even make that. That is not enough. Whatever they get from their Social Security, they can't hardly pay the rent to live. What I'm saying is, this is where we need to do our job. These CMS, CMS puts that money, additional $1,200 into the intermediary. Very first thing they do is they're greedy. They take the money and they curtail all the services. That's the first thing they do. Why can't you give that money to the Americans? They give them the certificate of need if you need to. Let them choose the insurance what they need. Have them put some money. Have them mandate them. Okay, if you're getting $1,200, you need to go and get a certificate of guaranteed coverage. Whatever you're saving, put that money into your health solutions advantage. Mandate that. That's the least they can do. They don't need the government. They're not asking for you to give money. They're asking you to provide the right tools, man. Right tools. I'm talking about, today I'm talking about purely well category. I'll talk about the at-risk group some more time. So when you're looking at the well category, 62% of the population are well category. They don't see the doctor. They don't go to, and why do they, especially even among seniors, that $1,200 government is wasting on the intermediate. Give that money to me. This year I've not been to the doctor. I could have saved tons of money, man. They're putting the money, they're putting the trust in the intermediaries. Medicare, come on. AARP, if you're AARP is such a big lobby. If you're listening, come on, AARP. Have them invest in Medicare senior. That $1,200 should not be going to the intermediaries. It should not become. It should be coming back to the senior. That's our money, hard-earned money over a lifetime. Give me that money. Tell him I will get my own insurance. I will save the money and put it into my own Health Solutions Advantage (HSA). AARP. Are you listening? Folks in Florida, a lot of members in Florida, they're members, and you know there are 60 or how many 60 million 65 to 70 million AARP members. I don't know what the membership of the AARP. I'm pretty sure is more than 50 million, but I'm talking about seniors on Medicare, 70 million, 65 to 70 million. If you are listening, next time demand that CMS, Center for Medicare, invest that money in you, not on the intermediaries. They're wasting that money. If I get that, if I have the freedom, I will get a total freedom on healthcare. And people who can't afford it, give them the certificate of need, guaranteed certificate of need coverage, and they will go and get the insurance. People who are handicapped, disabled, out there, they can, families, and they can handle it. Give them the tools. Don't mandate from top down. Give them the tools what they need. Give them the certificate for the guaranteed coverage. They will go and get their own insurance. Well, I've done my. It's amazes me. People can get it. It just. I love the coffee, man. I love it. I love it. Morning coffee with Consumers Doctor. What a good. I wish I had the chat to chat with my. I would like to build up the clientele. I would love to converse and exchange the ideas. There are people out there, I'm pretty sure there are lots of ideas on healthcare. We are a healthcare system in US is totally dysfunctional out there. It is lopsided. It's lopsided. The focus is on somewhere else instead of on Americans. Americans want freedom in healthcare, total freedom in healthcare. And there's a way to do it, man. There's a way to do it. This is not, this is not, I would like to achieve that before I die for my kids. I want them to have a total freedom. I don't like people telling me you have to go to this doctor, you have to go to this facility, you have to go there. Coming from India, I have more freedom in healthcare in India than here. I'm not kidding. I don't have to have a lot of money in India. If I don't have a job, I am unemployed, I'm on the street, I can go anywhere into the county facility, they'll take care of you. Here, no. They give you a Medicaid card, and which nobody wants it. Nobody takes it. None of the providers, they don't want to take care of the Medicaid. I'm telling you, every time, how would a provider take a Medicaid? I bill for 30 patients on Medicaid. I took care of them, right? They sent me a check for 1 cent. How do you like that? What kind of a healthcare system is it? They sent you a check with 30 patients on the list. And the billing. Why do we need billing, man? Billing is just waste. Lots of resources are being wasted in billing. Give them the coverage, give them the tools, help them set up Health Solutions Advantage, folks. Health Solutions Advantage, HSA have to be mandated across the. I would like to have everybody have Health Solutions Advantage, HSA, everybody, all 320 million folks. They have to mandate. They have to put money aside, and that has to be used only. They cannot withdraw it. They cannot, even though it's their own money. It is only for healthcare. That is only for healthcare. But you can pile if you want to. You can collect, you can pay cash, collect all that money, keep the receipts, and submit to the HSA. We can withdraw that money without penalty. But you need to have the documentation for IRS to look at it. If you want to pay as you go over a period of time, 10 years, collect all the medical bills you have and withdraw from your health. By the time, if a 30-year-old is healthy and working hard, making 50, 55,000, by the time they retire, I'm telling you, they will have anywhere from 300 to 500,000 into the health solutions advantage. I'm not kidding. Just by putting $300 a month aside for an individual or family of four, you can put aside 750, folks. And that is coming from your employer subsidized group. You're not employer giving you the insurance, and employer is getting you the coverage, and whatever it is you're being paid, that it's not an income for your personal income. It's going into the health solutions advantage. When employer is getting an insurance, he will also put money aside into the health reimburse, which ultimately will be health solutions advantage, HSA, which is yours, individuals, everybody. This is where the lower income people will come out ahead, man. There are people there. People live day to day. They can ends meet. This health solutions advantage. This is my dream. I would like to have health solution advantage for all 322 million Americans, so they can take care of their own money. Americans in general are good at heart. The thing is, their priorities are mixed up. They don't save money. That's the priority. They spend it. They spend it like just. You talk to the Asians. You talk to the Indians. They save. Americans, no, they don't save. They just, your check comes, check goes, and they, as a matter of fact, as soon as they get the check, they cash it. The money is gone. Come on. You can't do that. You have to save some money. The same thing with the health insurance, folks. This is what I like to see the government facilitate, provide the tools for health solutions advantage. I don't know how long I've been talking, but it's almost 30 minutes, guys. This is Consumers Doctor. I'd love to hear from you and get your opinion and get to know I can answer those questions. I want if Biden is President Biden, if you're listening, I want you to take care of the poor. This is what you're elected for. Take care of the people who need help. Give them the health solutions advantage, HSAs, for all Americans. Pass a, as a president, you can have executive order. Give an executive order. Everybody should have a health solutions. I don't know. I'm just kidding. I'm trying to get this thing and get the message across. We will see you again on Monday. This is Consumers Doctor. Thank you for joining. I love you guys. I would love to get feedback from you. Maybe I'm trying. I'm learning to stream. I'm learning to stream. Hopefully, I'll get there. So we'll have fun, and I'm pretty sure I'm just going to enjoy this. I love talking to people. So let's do it, folks. I'll see you on Monday at 6:30, every weekday at 6:30 for half an hour. This is Consumers Doctor. Bye.